This bacterium resides primarily in the female reproductive tract, specifically the vagina. As part of the normal vaginal flora, it coexists harmoniously with other microorganisms, contributing to the maintenance of a healthy vaginal environment. Moving forward, let's examine the characteristics that make Gardnerella vaginalis stand out. Visualize a gram-variable rod-shaped bacterium. This unique morphology allows it to form biofilms, which are complex communities of microorganisms adhering to the vaginal cells. But like every story, there's a twist. Gardnerella vaginalis has a darker side. It produces a toxin known as vaginolisin, which holds the power to damage vaginal cells and trigger inflammation. This toxin likely contributes to the discomfort and irritation experienced by some individuals with bacterial vaginosis, a condition characterized by an imbalance in vaginal flora. Now let's zoom out and observe the bigger picture. Gardnerella vaginalis rarely acts alone. It's often accompanied by fellow bacteria like Prevotella, Atopobium, and Snethia. Together they form a polymicrobial biofilm, creating a complex ecosystem that characterizes bacterial vaginosis. Prepare to be amazed as we take a step beyond the vaginal boundaries. In some instances, Gardnerella vaginalis can ascend to the upper genital tract, leading to more serious complications. Women might face infections like endometritis, which is the infection of the uterine lining, or pelvic inflammatory disease. This escalation is more likely to occur when other infections are present or with the use of intrauterine devices, IUD. The organism, initially identified by Leopold, was officially designated as Haemophilus vaginalis by Gardner and Dukes in 1955. This nomenclature was chosen due to its gram-negative rod morphology, successful isolation on blood agar, and its suspected association with a distinctive vaginal discharge. The organism's lack of requirements for X and V factors, hemin and NAD, respectively, which are essential for the growth of recognized Haemophilus species. Its propensity to retain the crystal violet dye in the Gram reaction, and certain characteristics resembling those of Corynebacterium, indicate that it may be more appropriately classified within the genus Corynebacterium. Zinnemann and Turner identified this microorganism as Corynebacterium vaginale. Following a series of biochemical techniques including DNA-DNA hybridization and electron microscopy, Greenwood and Pickett proposed the nomenclature Gardnerella vaginalis in response to the requirement for a new genus. Hence, this previously mentioned is the etiology of Gardnerella vaginalis.
The normal level of Gardnerella vaginalis in the vagina varies depending on a number of factors, including age, menstrual cycle, overall health, and pregnancy. Generally, a healthy vagina contains a balance of different types of bacteria, including lactobacilli, which help to maintain an acidic environment that is inhospitable to harmful bacteria. However, in some cases, the balance of bacteria in the vagina can be disrupted, leading to an overgrowth of Gardnerella vaginalis and other bacteria, which can cause a condition known as bacterial vaginosis. Normal levels. G. vaginalis normally lives in the vagina in small numbers without causing any symptoms. Its numbers are kept in balance by the normal vaginal flora and acidity. What are some tips to maintain a healthy vaginal flora? Don't douche. Your vagina does a good job maintaining a healthy amount of bacteria. Douching can create an imbalance among the bacteria in your vagina that can lead to infection. Use condoms or dental dams during sex. Having unprotected sex increases the chance that your vaginal flora will be disrupted and you'll get BV. Limit your number of sex partners. Having multiple sex partners increases the likelihood you'll get an infection. Gardnerella plays a role in maintaining a healthy pH, or a healthy amount of acidity, in your vaginal fluid. A healthy vagina has a pH range of 3.8, 4.5. It's considered to have a moderate amount of acid. The bacteria that make up your vaginal flora, including Gardnerella, work to maintain this level of acidity, which is just the right amount of acid for fighting infection. When the acidity levels drop, too much Gardnerella grows, and that's when an infection can occur. It may also be involved in the breakdown of certain compounds in the vagina, such as glycogen, which can contribute to the production of lactic acid and help to maintain a healthy pH balance. However, when Gardnerella vaginalis and other bacteria become overgrown, it can lead to an imbalance in the vaginal microbiome and cause symptoms such as itching, discharge, and odor. At normal levels, G. vaginalis is a harmless commensal bacterium that helps maintain the health of vaginal flora. When low-grown, the pH that is too alkaline decreases healthy vaginal flora and sets up an environment where infections like BV and Candida can flourish.